And you had the,
All right, good morning. Today is June 4th, 2024. The time is 9 a.m. This is the Health Committee. Have a roll call, please.
Duca,
Yes.
Schreiber,
Yes.
Hughes.
Yes.
Whitlow.
yes,
I have a motion to approve the agenda. Steve and Jack. All in favor, say aye.
aye,
All opposed, same sign. Motion passes. Can I have a motion to approve the claims? Everybody's had a chance to look at them?
so,
Can I get a second?
Oh.
Then everybody roll call is ready.
Duca.
Yep.
Schreiber,
Yes.
Hughes.
Yes.
Whitlow.
yes,
Public comments. We have nobody here for public comments. We'll move on from public comments to our animal control. Jill?
The total deposit for the month was $6,340. And those are for registration and any fees collected. There are 9 cases currently open. We have 1 bite report, 4 cats and 4 dogs waiting to get placed. We had a building inspection done on May 16th by the Department of Agriculture. It's for our animal welfare license certification, and we passed. And the license you'll see on there, I already paid for it, so we're already good for another year. The officers closed 37 cases last month. There were 11 dogs running loose, 1 kitten pickup, 4 bite reports closed. We had 2 hit by car cases, 1 dumped animal case, 6 welfare checks, 2 cases where the owner was hospitalized and there was nowhere for the animal to go. We had 2 left in rentals, an accident pickup. We placed 6 dogs. And we received 1 bat that came back as negative, but we did have to make arrangements and take that bat directly to the University of Illinois, as we couldn't get it euthanized or shipped out by Kankakee because it was late Friday afternoon. So it had to go directly to Dubai, which is closer than Springfield, so not a worst case scenario.
Anything else for animal control? How's the building?
Building's good.
So the bat had to be euthanized because
They have to be euthanized before they will do the
rabies.
rabies testing, because they test on the brain. And it's a pretty simple procedure, however, it has to be done by a licensed veterinarian.
But it wasn't an endangered bat. What do you do in those cases?
It was a what, I'm sorry?
If it's an endangered bat, what do you do in those cases?
That's up to the, again, it has to be a veterinarian to make that decision.
Sure.
And so if there was an issue with it, the University of Illinois would have contacted us and let us know what to do for the following step.
Yeah, something like that happened, what, 3 years ago? Same thing?
I didn't have anything, so it must have
It
been,
just so happens often there's a cat or a dog or a bat that comes on a Friday night and then it has to be driven.
Yeah.
By somebody, because if it's not there at a certain time, it's no longer a 5%. So.
All right, thank you, Jill. Move on to Eric for the Quick County Public Health Department.
You get 2 because I actually gave you 2.
Thank you.
Okay, by the numbers, front page, green environmental. 37 total inspections. 11 temporary permits issued. You had 2 plan submittals. A plan submittal is something that gets issued to the health department when we're working with a new restaurant that's planning on opening up. It's required that they give us this plan submittal, we have to review it and approve it. So that's for 2 places that are going to be opening up soon. One is a permanent, it's building here in town, and another one is a food truck. The reopening / opening was for the Milford Pool. They have a full permit through us, but they're seasonal. So 4 food complaints, however, all 4 were unfounded after investigation. Nothing terribly abnormal in water samples for wells. Private sewage as well, both of those areas are picking up business because it's here to dig now, so that's pretty normal for this time of year. We started our West Nile surveillance. We have done 28, taken 28 mosquito samples. Now that's not 28 mosquitoes, but it's 28 samples of population, so collection of nets with a lot of mosquitoes in them. And good news, nothing positive so far. We given out 3 radon test kits. And one number that's not reflected on this yet is new program for tick surveillance. We've done a number of tick drags in the past month, newly funded through our local protection. Go to some specific sites where we think we can find some ticks, grab some nets, and then collect samples of ticks and put them in a test tube and send them off to the state lab. We're looking for what types of species of tick, and then when they get sent to the lab, they're telling you know, does that tick have any sort of illness? So, any questions on environmental before we go to page 2? Okay. Our immunizations are up in the month of May. Basically trying to get people in early for back to school vaccines. Summer just started. It's helpful to us and to the parents if you schedule now, kids in now. So we made some phone calls of previous clients and got them in the door. So there's not a rush later. There was 3 animal bites in the month of May, 2 dogs, 1 was that bat that Ms. Johnson was talking about, which did test negative. The dogs did not need to be tested, they were just quarantined. Campylobacteriosis, all 3 of those were confirmed, but the source is unknown. It is known that they were unrelated. Three COVID-19 cases, that's way down. 1 COVID-19 outbreak, that was at the Congregate Living Center, like per usual. Let's see, just trying to get the highlights here. 1 salmonella case, the source was unknown. There was, in terms of sexually transmitted infections, there was 8 chlamydia and 1 gonorrhea. We've been seeing more sexually transmitted infections in the past year or 2. And we're looking into how your Hood County Public Health Department can assist the community in that. Don't have any details on that. I'm not quite sure what we can do with anything, but we're looking. Any questions before page 3? Page 3, tuberculosis program. We had 2 new case investigations. 1 was latent TB case and 1 was indeterminate. The test was indeterminate, meaning that they'll need to be retested if that individual is hospitalized and going to treatment. So typically wait until treatments cease before they are tested again. Treatments can impact the results of the TB test. So have that. Number of educational presentations, most of them Narcan. We did some CPR for the sheriff's departments, for 911 and 1 for a private citizen. Press releases. School health and services, you see those numbers there on the bottom. Those numbers will be crashed down next month because now it is summer. And our school nurses are back in the office. Same with vision and hearing on the last page. You see 17 of both of those are children's screens. You'll start to see those numbers get even lower for the summer months, and that's pretty normal, except for when we head out to Illinois, like a Head Start. We'll contract with them to do a few services, including vision and hearing. Senior services, we had 15 nursing home pre-and-post screens. It's a bit higher than usual. Total clients on services is 182. A new number that we haven't reported for is at the very bottom, Medicaid assistance. It's a new service that we're able to build where we help our CCD clients through Medicaid paperwork, which is extensive. So that's a new number that we're gonna reflect on our report. And that's by the numbers. Any questions on this?
Yeah, I'm not making complaints. I see it, it's complaints.
I'm not sure exactly what these nuisance complaints were. However, nuisance complaints, it's a county ordinance where if someone has excessive trash in the yard.
Oh, okay.
Or if they have
That's part I
garbage,
didn't know.
such like that. A nuisance complaint can be filed, and the health department, according to the county ordinance, is responsible for going out and confirming whether such nuisance complaint exists. And if it does, then we write a certified letter saying, hey, observe this from this day, you have this many days to clean it up. Don't hear back from them. Just continue to be non-compliant, eventually we send it over to the state's attorney.
I just didn't know what that
I'm
was.
glad you asked, thank you for asking. Any other questions on the numbers? A couple more things for y'all to be aware of. We are doing our public I-Plan survey. As part of our I-Plan process with a 5-year Quick County Health Plan, we need to solicit public participation. Our flyers are out, almost many places I can get them. And we really want public participation. So for any of your Quick County residents, if you haven't taken it, no, don't get a copy in advance. But please encourage your constituents to take the survey. We really appreciate it. We've been at that for about 2.5 weeks now. Got published about 2.5 weeks ago. So that also, I have a grant opportunity for sharps disposal for residents. So I wanted to ask for permission before I proceed with my idea. You see, what this grant would do would basically be pass-through money for us to be able to collect medical needles from people if they need it for any medical reason. Common reason is diabetes, but there's a number of other reasons why somebody uses needles for their own medical reasons, whether it's allergies, psoriasis, so on and so forth. What this would look like, my idea is to put in a public disposal box that is very secure, but out on the corner here with the parking. And I'm not tied to that specific location. My idea is to make it convenient, easy. It's very difficult to get into without a blowtorch. I know it's kind of a common concern that comes up, but these boxes, they can be anchored to the ground, and it's virtually impossible to get into them at blowtorch. So I wanted to ask permission before I put a public disposal sharps box.
Does the grant cover the whole thing?
It covers the box and it covers part of our disposal fees.
The other question I have is there a security camera that would be able to see that in case somebody was to
Not that I'm
or try to make problems? I could just plug it on a portion, I think it's the opposite. I think both sides of it. Good idea, camera, but I also think sure that
obviously that's the concern with somebody that wants needles for illicit reasons.
Right.
Those needles are easily accessible at drugstores, and cheap. So I don't think that's gonna happen. But I don't think there's a security camera out here. And trying to think of an easy solution on how to do that.
I think it's something for the board meeting, just let me know.
Yeah.
I think it's a great idea, I have no problem.
We've identified that there's no public disposal box in here, Quick County. We're not going to get, there's two possible benefits here. One, to get people that are hoarding their needles because they have nowhere else to put them.
How many boxes do you get?
Well, I'm gonna start with one big, it's like a post office box in the center.
That's what I was thinking, on the post office with it. It's at the post office. They come pick up their mail, they can drop it off.
And if you're only open during business hours. What happens is there a place the hospital would allow us to put on their property with cameras?
You know what, I haven't asked them, They can, I want it here for convenience.
Okay.
So that way when we need to empty it in, my staff will the driving wire, and just walk outside.
You get good security cameras pretty recently.
Maybe, yeah, so. That's some, security cameras is something I can look into to see if it's covered in the grant, what that would be.
I'm not wanting to make a problem for it, I just know that things can go different directions.
That's why I came and asked before I started this project.
So how about this one forward? I know I don't have a problem with gentlemen. I don't see that anyone here does. So if you have a recommendation, go ahead with it. We'd just like to know something that we can watch it securely. Somebody doesn't try to grab and walk off with it.
Sure.
Is that okay with you, gentlemen?
Sounds good.
We need a motion.
One motion for it, John? Please.
I'll make motion that we look into the box with ways to provide the video surveillance of it at all times. Make it convenient for the staff.
We also make a motion to accept the grant. You need to know that
You
also?
don't need to.
Okay, I just want to make sure.
Appreciate it.
Second that.
Aye.
I just want to make sure. Any other discussion? Any? What? Okay. When you're ready.
Duca.
Yep.
Gardner.
Yes.
Hughes.
Yeah.
Whitlow.
Yes.
Motion passes.
Just one more thing to mention to you guys, as of July 1st, we will be in this building for 10 years. We moved here and opened our doors for official ICPHD business on July 1st of 2014. Our share sports trailer and van came real handy as it helped move us all out here. I was been here for like 2 months at that point, so I was the new guy, so I don't move a lot too, but it's been 10 years, so that's something worth saying. That's all I got.
All right, thank you, Eric. Gentlemen, is there any old business? Any new business? Get a motion.
I'll make it to adjourn.
Steve with a second. All in favor, say aye.
Aye.
Motion passes.
Thank you.